Hello, everyone. Very good afternoon. Thank you so much for joining in for the session today. Medlearn team is super excited to bring another session for you all. As you are already aware that at Medlearn we conduct training sessions, virtual webinars on various clinical, non-clinical, soft skills, behavioral, NABH, nursing excellence, service excellence, etc. We do invite various industry experts to give the best of the information, best of the facilitation to all the members who usually join our sessions. Today, I am super excited to discuss with you all on a very interesting topic, as you might have seen already, that we are going to have a great discussion on team building, how team building actually helps. That we're going to see in detail how it actually helps in improving the patient satisfaction, it improving the patient experience, how interpersonal relations can actually help the an employee to bring that sense of belongingness in the organization. And I am going to make this session a little unusual. We are going to discuss on some tips, some techniques, some models, some management tools that we are going to see how those can be immediately applied. So my today's session is going to help you in strong implementation of what all we're going to discuss. You will be able to immediately apply this at your workplace. So before we proceed, I would want everybody to see what we do at Medlearn, what we are, what are the good things that we are doing in Medlearn to help the hospital professionals, achieve excellence in their work environment. So I request Subhashi to kindly play the video, and post that we will start with our today's training.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
Medlearn is a comprehensive learning, training and skill development platform incubated at Impulsys in India for healthcare professionals to attain the right mix of content, learning and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with Medlearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. Medlearn. Better prepared for better care.
Thank you, Subhashri. So let's get started. I will quickly share my screen. Yes. Subhashri, can you confirm if it is visible?
Yes, exactly.
Okay, thank you. So today we're going to talk about teamwork in healthcare, that is connecting, communicating, and collaborating. Before we go ahead, before I start with the management tools, let me give you a quick fact file. Facts increases the credibility of any content that we discuss usually. So, to all those members who have joined the session today, even if you are conducting your internal training programs within the hospital, ensure that there is always a fact file so that people feel that the topic that we're going to discuss is actually very crucial. So let me give you a quick gist of the facts that why this session is really important, why connecting, communicating, collaborating in a hospital healthcare setup is really important, and how teamwork directly impacts the patient care, patient satisfaction, patient experience, and not only just patients. An employee well-being is also dependent on how cohesive the teams are, how the culture of the company is, the culture of the organization is. And trust me, please don't feel that it is just the leadership responsibility to maintain the culture in the organization. Every single person who is working in hospital has the responsibility to develop that positive atmosphere in the hospital, to develop the culture of collaboration in the hospital. Patient safety and medical errors, I have also given from where this research data is coming from. So effective teamwork reduces medical errors significantly. We all know that, right? So a study published by Annals of Internal Medicine found that teamwork training programs resulted in 19% reduction in medical errors and a 30% decrease in the surgical complication. You might have seen that at the time of surgery, there are a lot of checklists that we follow. An entire team is involved. When a person is being taken to the operation theater, there is a team of technicians, there is a team of doctors, team of nurses, there is CSSD team, there is biomedical engineering team to take care of the equipments, there is infection control and safety team. So the entire team collaboration results in the better patient surgery. So patient safety in medical errors reduces when the teams are very cohesive, when there is a strong interpersonal connect within the teams. So the nursing, how they're communicating with the doctors, the communication with between the doctors and the patient attenders. When it comes to OT clearance, OT implants, OT surgical instruments, all those things, if people come together, collaborate, communicate well, we can actually see that the medical errors, surgical complications are dropping. Patient outcomes. So hospital with strong teamwork culture. Now what is this strong teamwork culture? What we all should do to ensure that the the teamwork environment is there, people are actually having an open communication with each other. What are the tips that we can apply at our workplace to ensure that the team collaboratively works well and our patient experience and overall team's employee productivity, employee well-being is improving? So that we're going to discuss today through a lot of interesting management tools, and I request everybody to stay connected till the end because we have some interesting techniques coming up which are very easy and very quick to implement. So hospitals with strong team environment, team work culture has better patient outcomes, that we all know. So a recent study by research in the Journal of Nursing Administration, it has indicated that hospitals with better nurse physician collaboration and communication had 25% lower odds of patient mortality. It's so serious, critical, and significant. You all will agree with me that patient mortality, 25% of reduction, lower odds of patient mortality, just based on, just because the nurses and physician has a strong communication, we are actually able to bring some changes in the healthcare setting and improve patient care, treatment, etc. Care coordination. So improved teamwork enhances care coordination, leading to better patient management. Just a simple example I will give you is bar. The ISBAR tool that most of the hospitals use for the nurse handover, takeover, the communication within the nurses, right? So just promptness, measuring the effectiveness of a communication tool between the nurses or among the doctors, right? So a better care coordination, understanding of the care and treatment guidelines, treatment protocols, everybody understand, everybody communicates with each other. Because of this, the interdisciplinary teams work efficient, and 15% decrease in hospital readmission rates. So just by ensuring that our teams are feeling safe, our teams are collaborating, there is inter-team communication very efficient. Just by this, we can reduce medication errors, we can reduce readmission. How fantastic is this? So efficiency and resource utilization, that also in a research by American Journal of Medical Quality reported that hospitals with strong teamwork practices, 13% shorter hospital stay on an average. You might have heard about patient average length of stay. So we can reduce the length of stay just by effective team coordination. So what are these techniques? What are these tools that we can use to ensure that our teams are feeling safe? There is a healthy culture. Let's start with understanding what are the 8 layers of a company culture. What makes a company culture great? In context to healthcare, I would like to apply this. Number one, you might have heard that in your patient rights and responsibility, employee rights and responsibility, respect. Respect is one of the key element in ensuring that there is strong team culture in the hospital. So to all the supervisors, to all the managers who have joined the session today, my number one request that the owners of the company culture very much depends on you. Not only just you, every single employee, but number one request is please do not give feedbacks in patient areas. Sometimes I have seen when management goes on a round, and if they feel that okay, there is some deviation from the protocol, if they feel that you know suppose the cannulation is not done properly, or there is a biomedical waste segregation which is not done appropriately, or there are some patient protocols which are not being followed, there has to be a feedback involved, but it should not sound disrespectful or belittling to an employee. So have open feedback, but not in open spaces. You should give one-to-one feedbacks. People should not feel disrespected. So one of the quick thing that we all are going to apply immediately after this session is, if you feel, or if somebody in your organization feel that the person is being disrespected, the tone was not proper, the tone was sarcastic when we were having our interpersonal communication, please give a check. Did you feel bad? Was my tone wrong? Did you feel disrespected? Sorry, my intention was not that. It's always to have a quick check on the person's mindset, the way the thing is being communicated, whether the person has felt it in a disrespectful way or the person has just taken the feedback. This understanding, this conscious effort will bring the sense of belongingness among the employee. They will feel safe at workplace. Even if you are giving a feedback, there is a way of giving a feedback. How you are going to give feedback to your team members, how seniors are going to give feedback to their juniors and subordinates, how juniors at equal level are going to give feedbacks to each other. That all we're going to discuss today. Open communication, of course, people should not refrain from communicating each with each other just because they have a different style, they have a different pattern of communication, their personalities are different. I'll personally share my example that when I was working in one of the hospital, there were members, there were members who were very stiff in communication. Their way of communication was uh, their way of communication was very rigid. They were very flat in communication. Their tone was sarcastic. Their tone was very disrespectful. Because of that, people refrained from communicating with them being the critical department of the hospital, just because they had a very rough communication, people used to avoid, which blocked the open communication. So if a little alter in the personality is required just to ensure open communication, please do that. So encourage honesty, encourage open sharing of ideas and feedback. To all the members at the mid senior level today in this forum, If you feel that because of differences in the personalities, because of lot of arguments, the team is not establishing an open communication, as a manager, you have to bring everybody together, sit in a forum and talk openly. One thing I would really appreciate about nursing team, I have personally witnessed in every hospital that every day all the nursing in charges will meet. They will have a discussion with the nursing superintendent. They will have an interpersonal communication, uh, and their open communication is so strong that in spite of having sub departments in nursing, still they have a strong cohesion. Similarly, at in charge level, if I am the ICU in charge, I will bring all my ICU team together. I will have an open communication about it. If people are not happy with each other, if they do not like the way the other person is working or communicating, they can talk to each other without any barrier. So leaders, mid senior people, supervisors, they have the responsibility to bridge the communication between the employees, and employees should also feel that there is a need of open communication to ensure that the team is strengthening day by day. Employee growth, right? So invest in people to develop their skills and provide opportunities. If your organization has asked you to join this Medline session today, that means they are concerned about your growth. To all the supervisors, my personal thank to all the members who have insisted their down the line team to join the session today, because this shows that how much you are involved in the growth of your employees. So whenever there are training sessions program happening, your organization is planning certificate program for you, when there is some upskill professional development program or certain feedback which is given to employees on improvement, please attend those training sessions. This involves your growth. So growth is not only just in terms of salary, that how much money you have gotten in span of 3 to 4 years. Other than money, it's about your learning also. Earning, you are definitely going to ensure, because everybody is competent in some or the other way. But after that, after earning, your learning also matters in your entire growth spectrum. Collaboration, we're going to get into a detail how collaboration adds up to the company culture. Leadership commitment, the foundation where leaders set the tone and led by example. If the leaders are not good, if the leaders are dictators, if the leaders they have micromanagement attitude, if leaders they only focus about the revenues of the organization and employee well-being is going for the toss, the company culture of collaboration will never be able to establish. So even if the leadership is involved in a lot of other stuff, in a lot of stress and tension, the down the line leaders, this middle management, the second in line members, they also have the equal responsibility to lead by example. Employee well-being, so prioritize mental health and personal lives alongside professional duties as well. If you have seen in the last 3 to 4 years, there are a lot of yoga sessions, stretching sessions, personal safety sessions, occupational hazards, understanding how their regular vaccination of employee, their health checkup, mental health awareness programs. All these things have just started much more rigorously. Why? Because there is a need of employee well-being, and us being from the healthcare, it is a constant need to keep a check on the employee mental and physical well-being. Shared purpose, this we're going to get into the detail. And no toxicity, how you going to manage the burnouts, how you going to manage the inter-team conflicts, how you going to manage that if there are two departments, they're locking horns, and the work is going for the toss, the patient experience is going for the toss, how you are going to bridge and mediate that particular situation. All these are the 8 layers of a company culture. Many of you have heard about Maslow hierarchy of needs. As I said, this training is going to be little unusual. I'm not doing a PPT based presentation. Rather, I'm giving you specific tools. This company culture layer, we just understand that what all tools are there in the pipeline for today's discussion. Our number one tool to understand is Maslow hierarchy of needs. Now, Maslow hierarchy of needs, an organizational behavior, we everybody in this forum, more or less, we have heard about Maslow hierarchy of needs. If not, let me give you a 5 pillar of a triangle to understand the 5 elements of Maslow hierarchy of needs. Basic belonging needs, esteem needs, growth, growth needs, and self actualization, right? So, this is the hierarchical presentation that we have done to understand the team building process and team collaboration. Number one, employees will feel engaged, employees will feel involved when their basic needs are being fulfilled in the organization. So team members need to feel safe and secure in the roles. So very important element that there should be clear roles and responsibility for a healthy team culture. Not everybody can do everything. A small example, whenever a nurse joins the duty in the ICU or the ward, there is an assignment register where there are clear assignments mentioned to the nursing team that these are the assignments given to these many staff members. Similarly, having a clear job description, having clarity on the job roles. If I have been assigned a job role, but I am not very competent enough to perform that particular role or perform that particular duty, the number one thing as a supervisor I need to do is to help them, getting proper training about it, to help them getting deeper understanding of that particular role, to give them a buddy mentor. I'll give you an example. Apollo hospitals, they have in the nursing, they have started this mentorship program, nursing preceptorship program, where mentors are assigned to the staff members who feel that they do not have sufficient hands-on experience to perform a particular task. They have a senior member mentoring them, because of which they feel empowered. They feel that okay, we have a supervisor whom we can reach out to, whom we can talk to, so that there are reduction in errors, so that we don't make any mistakes on the patient side, because it's critical, of course. So basic needs, number one, the base foundation is people in the team should have clarity on the roles and responsibilities. Next is the belonging needs. Team members need to feel a sense of connection. If the team members, they do not feel connected to each other, they are clueless about their personalities, they don't know how the other person is feeling, there is no open communication. So for that, belongingness need will not get fulfilled. So for that, what to do? Plan team building sessions. Plan, you can plan fun Fridays, you can plan freezy Wednesdays, Tuesday talks, open communication, Monday motivations. Every day you can theme your day in such a way that team is coming at one forum to talk to each other, so that the connection can develop. If the team members, they do not have connection, the belongingness need will not fulfilled. So if the belongingness section is not fulfilled, the esteem need, the recognition will not be able to get established. I'll tell you why. So if my team is not feeling very connected to me, they will not recognize my efforts, they will not appreciate me, because there is no connection, there is no sense of belongingness, that okay, I belong to such a great team. If that is achieved, then my esteem needs will be fulfilled, that okay, my team appreciate my work, my team involves me when the entire teams have a win-win. At the time of NABH, whenever we have a successful NABH certification audit, the team feels so much valued, okay, that I also participated in the NABS certification program, that because of my involvement, somewhere up to a certain percentage I involved, because of which I helped my hospital to get an NABS certification program. So when the teams appreciate each other, that okay, I would like to specifically mention the work of quality team, HR team, or the entire operation team, that how they have involved and collaborated, to get the hospital and NABH certification. So just a small example of how people feel valued. So involve each and everyone in the recognition process. Therefore, constant reward and recognition is very important. You cannot miss out on R&R activities of the hospital. Also, bring the entire team on the forum to receive an award. So if you have individual awards, you should have team awards also. Team awards will have a team recognition, will bring cohesion. in the organization. So if you have individual achiever award, well and good, but there should definitely be team awards. If you do not have team awards already in the hospital, please start the team award as soon as possible. And you can also specify and highlight the individual effort from that team, that okay, if you are giving an award to the entire quality team or infection control and safety team, what each member has done to get that award for that entire team, that also you can do to bring the sense of self-esteem recognition within the team. So basic need, belongingness need, and esteem need. After that, there is a growth need, development, learning and development, talent development, talent engagement. You might have heard this vocabularies in the hospital, where we are just in the hospital quite often. Team members need opportunity for personal growth and professional growth. How much so? Whenever, in my previous association with the hospital, whenever I used to take interview for the nurses, I used to tell them that you are entering my hospital as a bedside nurse, or a junior doctor, or a resident medical officer, or a technician, or a housekeeping supervisor. I promise that you will not, if you stay in the hospital for a time being, you will not exit the hospital with the same level of competence. Of course, there will be add-ons in your competence, right? So what developmental activities you are conducting in the hospital for the growth, for the upliftment of your employees, also very critical. So please plan professional development program, individual development program. Appreciate people who are achieving success in terms of their career, in terms of their professional growth. If they're achieving that success, appreciate that. So growth need, esteem need, belonging need, basic need, these are all interconnected. Once all the four elements are being successfully fulfilled, then there is self actualization. When I say self actualization, people will participate and would be ready to do anything for the growth of the hospital, for the growth of their own team. They will not do anything which will belittle their team. They will have a sense of purpose, that okay, I have joined this hospital with a purpose, and I need to work very hard to achieve the goal and of my team and my own personal values. So self actualization, people will find the purpose. You need not have to motivate them, they will be self motivated. And once that is achieved, you will see that every single person in your team is acting as a leader. So they will inspire, they will empower their own team members, and everybody will feel that, okay, I am the leader of my team and I have to ensure that my team is effective, efficient, my productivity is high. I have to work for the upliftment of my team. So after the fifth, there is plus one, that is sixth, where leaders are created. You will be able to see that every person in the team is empowered, is having a sense of belongingness for the team, for the organization. So a lot of time healthcare leaders also reach out to us saying that, can you take a session on belongingness? Actually, belongingness is not just a one time affair, it's a process. The belongingness will take time. Where to start from? Start with basic needs of the employee. Basic need of the employee, I'm not talking about lunches, I'm not talking about facilities of the buses and the hostel, not those needs. I'm talking about their needs to be fulfilled as a team player in a team. Okay, so when it comes to the basic security needs, it's about clear roles and responsibility of a particular individual in a team. That is number one. They are very clear with how they are going to perform a particular activity. Are they being trained enough? Are we as a hospital giving them enough support and resources to fulfill their duties properly? All these will collaboratively help them get that basic need. So six tip for leaders to build a high performing team. This is for all the leaders, mid senior supervisory members who have joined. Have regular one-on-ones. Number one, with each team member, ask about their goals, their challenges, any new ideas, any initiatives that they want to take, and don't speak, just listen to them. So, number one, for better team coordination, have one on one with your managers. Give specific timely feedback. You can give feedback to each other, you can take feedback from your managers. Even if your managers are not giving you feedback, You can go to your managers and say, sir, you have been seeing my work from last 5 to 6 years, ma'am. Can you now give me a feedback of what do you think I should improve? Initiate a feedback. That is the best way to ensure team collaboration. Set clear expectation. As I said, there should be clarity in the roles and responsibilities. Create opportunities for team bonding. So for team bonding, you should have some fun activities within your team to ensure that your team is bonding. Delegate. We are going to talk about how delegation is important and so critical. I'm going to share some insights on how to delegate properly and model the behavior you want to see. So if a specific behavior which you don't like, you have to ensure that you are also not displaying that behavior in within your team. So this was Maslow hierarchy of team building. Now, as we are talking about communication, many of you have heard about 7C of communication. When we talk about communication, non-verbal, verbal communication, clarity, communication barriers, 7C always come into the picture. Now, I'm not going to get deeper into what is the 7C of communication, but rather today we are going to focus on how to apply this 7C of communication in the organization. So, coherent, clear, concise, correct, complete, courteous, and concrete communication. You all know the extended version of the 7C, right? Now, let's apply how to use it, how to use 7C in your daily routine, how to apply 7C in your personal life. Of course, when you are working in any organization, you cannot just think about the organization and totally discount your personal life, right? So 7C in personal life and 7C in your professional life, both application we're gonna discuss today. So, how to use it? Number one, plan before communicating. Think about your message and how to convey 7C. Number one, in hospital setting, even if you are communicating to doctors, nurse-doctor communication, communication with the staff members, communication with the patient relatives, communication between I mean, it could be doctor to nurse, doctor to doctor, from clinical team to admin team, whosoever is communicating to whosoever other person. Please ensure that we think about the message, we think about the impact, and then we discuss and convey our message. Now, you might have heard that, Varun, it's not always possible to think about the message, because the hospital environment is so dynamic that it's not always we are not always able to plan. Actually, it's not possible to plan the message. It's okay. At least develop a neutral tone of communication with your subordinate, with your staff members. It should not be very emotionally charged when you communicate to them. It should not, you should not, your happiness, your upsetness, your disappointment, your sadness, these things should not be reflected through your communication message. Seek feedback from others to ensure that the message is clear. Ask them, are you able to understand? Are you able to comprehend? You want me to repeat? Are you getting my point? Do you want me to explain it in another way? Do you have any questions? If you do not have any questions, can I ask you a question so you can probe a question as well? And adjust with the communication style of others, right? We may be very clear in the communication. So if I'll talk about myself personally, I'm a person who is very clear in the communication. I keep my communication very structured, but not everybody is able to do so, right? So adjust with the communication style of others. Okay. Now, applying 7C at work. Number one, in a team meeting, state the goals in a very simple term. Whenever you have team meetings, if you are coming with a goal, if you are coming with an objective, if you have an agenda, with every team meeting, have a clear agenda, have a clear objective, that we are meeting today with this agenda. We welcome ideas. So your ideas, your agenda, your initiatives, your requests from your team members, it should be very clear, non-ambiguous, clear expectations, clear roles, clear responsibilities. I'll give you a small example. At the time of NABH, JCI, NAPH, ISO, WHO, any audit, or if even if there is an internal 360-degree audit going on, have clarity. Who is supposed to do what is the agenda, what is the outcome that we are expecting, that we should have very low NCs. This person will do this person will take care of the indicators, this person will take care of the analysis and assessment, this person will take talk about the initiative. So clear responsibilities, so clear communication about the agenda, initiatives, objectives, and expectations. Concise, send a brief email summarizing key points. So whenever you are conducting a team meeting, develop the habit of sending the minutes of the meetings to every team. Even if it is the junior most, they should get the MOM of that meeting. Why? Because they will feel involved. If there are any decisions that the team is taking, they are involved in the decision making process, they are involved in the journey of team upliftment. Concrete, so having specific examples, so I'll tell you, to concrete an understanding, psychology suggests that in order to concrete an understanding, you need to illustrate, you need to demonstrate, you need to give examples. If there are just words, people will not be able to remember it for a long time. So the attention span, the retention of that information might be low. So what we need to do is we need to concrete the understanding with the help of examples. Correct. Double check the data, double check the report, double check the understanding also. What I have communicated and what you have understood. There could be a gap in between. So there should be a room of correction. That if the person has understood it in the wrong way, you can propose that, okay, let me check if you have understood it correctly or not. So have an understanding check also whenever you are communicating with your team. Coherent, ensure your presentation follows in a logical sequence. Whenever you are presenting something to your team, whenever you are discussing something, it should have a meaning to it. Sometimes we miss out the underlying psyche of our team members on whether they are able to understand in the same way I have understood. Sequence your thought properly. There should be a coherence. Your information should be complete. A lot of time I have personally faced this challenge where communication was not complete. It was only half communicated, and rest it was left for me to understand. Rest the person asked me to put my own logic, which gave me really difficult time to get the outcome on time. I kept on shifting my timelines. So the communication should be complete, and of course it should be courteous. Now, to create that culture, what all the phrases that you can use within your team? I trust you to take the lead on this. If you will say this, how will it sound to the employee? I feel empowered. How can I best help you? The person will feel supported. You are a big part of our success. When you will say this to within your team, they will feel valued. I really appreciate your ideas and point of view. If you'll say this, your team feels that, okay, my ideas are good. I can come up with more ideas. What would you like to learn next? If you'll ask your team members that, what all you would like to learn, is there anything specific you want your team to work on? If as a manager, if you want me to help you with something, your team will feel that they can grow within your team. Amazing job, well done. If you'll say such things, they feel that, okay, my future is bright. I can rely on this organization for my personal and professional growth. Thank you for your hard work. The person will feel appreciated. Remember to take time off for yourself. Don't burn out. Take time for yourself also. Rest well. The person will feel that, okay, my well being is secured. I have the freedom. If I'm feeling low, I can just go and speak to my manager about it. You've got this, that the person believes in me. What do you recommend? If you'll ask their recommendation, they will feel that, okay, my trust is being my judgment is being valued, my ideas are being trusted in the team. So use these phrases, and these are the impact, these are the words that the person will feel within. So start using these words in your team. They will start feeling valued. Okay, so how to motivate the team? A lot of time people miss out on understanding that their team members could be disengaged. How to have a quick check, understand the purpose, whether they know about what exactly they want to do, what exactly they're supposed to do. Are their goals are clear? Have you helped them as a manager or as another team member to set goals for their own self, or to set goals how they can participate in the team? Provide opportunities for growth. Train your team members. So there should be constant train the trainer programs. There should be constant interdepartmental trainings, so that people feel that okay, I know much more about the organization. I know much more about the other clinical departments than I used to. So earlier I joined as an emergency nurse, but now I know about ICU protocols. I know about cath lab, dialysis. Why? Because of the interdepartmental trainings. Now I feel more empowered that I can operate and I can work in any department of the hospital. So, is there a work-life balance? I'll tell you, with the hospital, it is something which is really challenging. That the work-life balance goes for a toss. There are double duties. The patient ratio get disturbed. The nurse-patient ratio get disturbed. People they have to do, extended duties. Sometimes they have to, avoid leaves as well because of the work is not getting finished timely because of the high occupancy in the hospital. Uh, the work life balance can go for a toss. At that time, you as a team player have to check on the mental well-being and the physical health of the other team members. So create an inclusive culture. People should feel that they are heard, their voice is being heard, everybody counts. So whenever you conduct your internal team meetings, everybody should be given an opportunity to put their own points, or also they should be given a platform where they can talk about that their work life balance is not getting stable. So how as a team member you can help to empathize better, to help the person balance both work and personal life. Foster a positive work environment. Many people feel that to foster a positive work environment you need to eliminate negativity. No, don't eliminate negativity, you just have to address negativity. That why, from where this negativity is coming from, why the person is negative. If you might have heard about Shackleton, Shackleton was a voyager, and and how he managed his team. If you get time to read about Shackleton, do read that how he has managed the negativity of the team members, and how it helped him achieve success. As an entire team, as a team leader, how he became successful along with the effort and uh, you know with clear involvement of his team member. So positive work environment, please feel that it does please understand that it's not eliminating negativity, that nobody should be negative. That's not positivity, that is forced positivity. Everybody should be able to feel the freedom that okay, if I feel negative about something, if I am not satisfied, if I am not happy, I have a platform to share that with my manager, to share that with my team also. So not to eliminate but to reduce the negativity by addressing, by listening to the person, and finding or chalking up way out, so that the negativity will automatically starts getting reduced, and there will be a positive work environment which will automatically get created. Now, talking about emotional intelligence. Now, why I have put this slide here, that all of a sudden, how come we started talking about emotional intelligence, right? So, when you talk about empathy, for that matter, empathy is a very important skill to develop, or important mindset or attribute to develop, especially when you are working in healthcare. Empathy is one of the most trusted and valued emotion, to ensure that the patient feel that they are cared, and they are safe in the hospital environment. But empathy is such an intangible attribute or skill that it is sometimes people get clueless that how to develop empathy. I don't know how to imbibe empathy in my own organization. I don't know from where to start if I have to start working on empathy. Many people, they courtesy, it's very easy to address, it's very easy to notice that the person is courteous or the person is just disrespectful. But whether the person is empathetic or not throughout the conduct in the patient care, it's very difficult to measure. So if you want to develop empathy, start working on emotional intelligence. Now, okay, I'm ready to start working on emotional intelligence. Where can I start from? Number one, start from understanding your own emotions. From there, we will go to understanding. From understanding emotions to, we will shift to emotional self-assessment. And then I will go to building my relationship and emotional growth. And then I will be able to develop empathy. Let's quickly scan what emotional intelligence is all about through a roadmap. So, number one, recognize your own emotion. Identify triggers. What is something which triggers me to be, if somebody gets angry very fast, what is the trigger for that person? In psychology, we have studied that name it to tame it. In your HRMS also, I have seen that how do you feel today? Like a pain scale, like excellent, good, very good, average, poor, sad, very upset, disappointed. In HRMS also these days they give you that emotional emojis to identify how are you feeling today, right? So that is nothing but exactly identifying that what is your emotional state for today. If you are irritated, if you are annoyed, if you are not feeling supported, your emotional reflexes will appear in your patient care no matter what, right? So number one is start with understanding your own emotions and identify triggers. What is that something which triggers you to get angry? What is that something which makes you very emotional? What is something that makes you very upset and disappointed at workplace? So identify your triggers as well. Once you have identified, you will be able to identify the emotional consequences. If I will react in such a way, what could be the consequence? If I will shout in front of the patient, what could be the consequence in the longer term? Immediately you might not be able to see the consequences, but in the longer run it will you will start feeling a disconnect with your team. Also, your patients will not feel safe. Next time your patient, if the same patient comes, they will not prefer that particular staff members because the person gets agitated. Now, these three things are done. We understood our emotions, we understood our triggers, we and also realized that what could be the consequences. Once these three things are done, we have to start managing our stress proactively. I'll tell you, love is blind and every other emotions at its peak. This I heard from one of my professors, that love is blind and every other emotion at its peak. That even if you're extremely happy, extremely sad, extremely angry, it will make you blind and you will end up doing something which you will regret later. So manage your emotions, manage your reflexes, manage your emotional responses. And at the time of stress, the management go for a toss. You are unable, you lose the ability in that stress, in that frustration. Sometimes we lose the ability to manage our emotion. So to manage our emotion, we have to equally manage the level of our stress as well. Express emotions constructively. Sometimes people feel that I will look vulnerable if I'll share my emotions with my team. No, if you have that sense of belongingness with your team, express emotionally but constructively. The emotional construct should be in such a way that people should understand what exactly are you feeling. uh, uh, Build emotional resilience, implement emotional intelligence training. Now these are all the tangible aspect of that. Conduct emotional intelligence training programs within your organization. Monitor your emotional growth. So I'll tell you how I monitor my emotional growth. So earlier I was a very impatient person. Slowly, when I give myself time, when I wait before I actually react or respond to a particular situation or emotion or a communication statement, when I wait, I measure the consequence, I construct my communication accordingly, and then I communicate. So I'll tell you, when I practiced this, one thing which helped me, I can take only my example, what worked for me, what did not. You can also share your experiences in the chat box. So what worked best for me, that when I waited before reacting, it brought a little bit of patience in me, that okay, even if somebody is angry, I will take my own time. Okay, so when I took my own time, it brought patience in me, and that's how I tracked my emotional growth. So you also can track your emotional growth. Identify the emotion which is triggering, which is making you look bad in front of others, which is making you feel that there is a drop in the productivity. Identify that emotion, start working on it. Also measure the progress, that how much you have developed in that particular emotion. So just because you're emotional, you should not refrain from expressing your emotions. So practice perspective taking. Sometimes there are people who don't bother about others' perspective, what others feel. So you might have heard that there are two sides of the coin. I may be feeling this way, but the other person might be feeling the other way. Of course, there are difference in personalities, that difference in the work environment, there is different in the communication pattern, they're different in the upbringing, there's difference in the educational status, there's difference in the family background. Of course, people are different from each other, right? So their emotional mapping will also be different. At that time, understand perspectives, understand where the person is coming from, observe their emotions, and then you'll be able to cultivate an emotional leadership. Many people have not heard about emotional leadership. So as an emotional, what is exactly is emotional leadership? Nothing but to be accurately aware about the emotional status of your team members. It's a very important skill, and it's a great skill to have as a leader, that you are aware about the emotional mindset of your emotional status of your team member. You know exactly how they feel. This comes with spending a lot of time with your team on ground. So as a leader, try to develop that emotional leadership. Now, once we are done with the emotional understanding of our own self and emotional understanding of our team, then comes the trust matrix. How will you develop the trust factor in your team? Let's quickly have a scan of it. Transparent communication, that we have been telling since the beginning of this session, that there should be openness in the communication, there should be clarity. 7C you can follow to ensure that there is a transparent communication. Consistency, keep communicating to your team. That brings reliability, that ensures predictability. So be consistent in your actions, decisions. Be consistent in your behavior. If your team policies are constantly changing, your team overall consistency will drop. There will not be trust on the manager, there will not be trust between the team members. So your team protocol should not constantly change, otherwise you'll not be able to get consistency. Integrity, demonstrate honesty. So if you want the person to showcase integrity, then first you yourself have to show that honesty. Your managers, your down the line team should be very honest. Then only you can expect your juniors to show that integrity at workplace. From integrity, very thin line connected with belongingness. So if the person is very honest in their work, they are always doing the right thing, even if it is challenging. They don't compromise on respect, they don't compromise on trust. Slowly we'll see that the sense of belongingness is improving. Show empathy. With now, how to show empathy, we have just realized. How to develop empathy, start with understanding your own emotion, which ultimately will lead you to cultivate emotional leadership. Show empathy when there are conflicts, when people are in the conflicting term, when there are locking horns, there are difference in perspective, when there are having arguments. Convert the arguments into a healthy argument. Convert argument or conflict to derive some excellent ideas that can work in favor of the team. Follow through. So how to follow through? Honor commitments. If you have promised something to your team, if you have promised something as a team player, be on it, work on it. Don't change your commitments again and again. Be a person of your own words. You should not change your words, because the entire premise of your personality that you create, the person might have that the person might lose the trust and the reliability on you, that your ideas, your goals, your objectives keeps on changing, so you cannot be trusted. So bring that trust factor in your team. Whatever you say, be on your words. Whatever you promise, keep up your promise. Constructive feedback, we're going to discuss that in the detail, that how constructive feedback can bring cohesiveness in the team. Encourage open dialogue. It's somewhat similar to transparent communication, that create a safe place where people feel that they are empowered to put their own points. Acknowledge achievement, even if it is the slightest improvement. I'll give you a small example. Suppose a patient got admitted in the hospital with a lot of complication, but slowly and steadily that there is some improvement in the patient. Appreciate the doctor, appreciate the technician, appreciate the nurse who are working on that patient. Even if there is the slightest improvement, acknowledge the achievement. Admit mistakes. People should not be afraid of telling you that they have done something wrong. If they will refrain from doing so, there will be low margin of correctly of correcting it timely, which will make the problem grave, which will ultimately reflect in the patient experience. Supportive leadership and nurturing leadership. So offer support and guidance. Act supportive, boost confidence of your team members. Active listening, there is a reason why we have 2 ears and one mouth, because we have to listen more. Listen to your team, understand their concerns, and then you will be more reliable. Be available for your team when they need you. Now, in the previous metrics, we talk about constructive feedback. If you can just check the sixth tile on constructive feedback, how to give feedback. Let me start with the constructive feedback model. Feed, FEED. FEED stands for fact, effects, expectation, and development. There is a reason why I have taken feed first. We'll also discuss boost, coin, grow, setter method, and 360-degree review feedback method also. Let's start with feed. Fact. First, tell about what exactly have you observed. Why are you giving that feedback to that person? Effect. Why there is a need to give the feedback. What is being affected with that particular act. Expectation. If you want the person to correct it, eliminate it from the work style, change it in their personalities, what is your expectation out of that feedback? And development. What the person is supposed to do. Be suggestive also. Don't just give feedback and go. You can also give suggestion on, okay, this has helped me, you can do this to improve. So be suggestive also. Help the person to understand how I can develop and change this particular behavior if you are giving me a feedback. Next is the grow model of feedback. GROW, goal, reality, option, and will. Grow. Identify what the person wants to achieve. I understand you want to lead this project. So if you want to give them a feedback, first give them a goal that, listen, there's a sandwich way of doing it, which is called as a sandwich model of feedback. First you talk about positive, then you give a slice of a constructive feedback, and then again you say positive. For example, uh, I love your work, you are a great person, you are a great team player, but there are certain things that we could improve to ensure that our team is working efficiently. You as an individual is feeling more productive at workplace. There is something that you need to change, XYZ. Again, in case of any support, please let me reach out to me. I trust you, and I'm sure you'll be able to apply this feedback, and next time you'll be able to do it in a much better way. So when you're giving feedback, set expectations, assess the current situation. You cannot just randomly go and give the feedback. You have to assess the mental state of the person also. The person has done something wrong, the person might be frustrated. So when you gave the feedback, the person got agitated, and sometimes people take decisions like just going and resigning, right? So do a check on the emotional status of the person. Give them options, explore possible options and path, that okay, what do you think could be the right way of doing this. You can also shadow the person by the time the person is improving. You cannot just give the feedback and leave the person on its own, that okay, now you develop and come up with a better version. No, help them, shadow the team members. If they have done something wrong, help them till the time they recover that that loss, till the time they get into a safe zone of actually implementing their feedback in their personality. Shadow them, be around them, and we'll commit to specific steps forward. What is the next step after applying this feedback? What are the next step that you should be doing to ensure that these such things do not repeat? Because some people feel threatened that, okay, this might change my entire personality, I'm not like this, right? So sometimes people feel vulnerable also. Give them space to be heard properly. Coin context, observation, impact, and next step. That is the third step of how to give feedback. Set context, describe what you saw, what you observed. If there is a behavior, if it is an act which needs to be corrected, set context. Then tell what all you observed. Impact, why the person is supposed to change this, what is the impact, what are the consequences, and what are the next step. Suggest improvement plans, suggest action plans that can help the person to improve more. Now, this boost model of balanced, objective, observable, specific, timely is the crux of feed, grow, and coin. That's why we took these three first. So feed model of constructive feedback, grow model for coaching, coin for behavioral correction, or for positive reinforcement. You will see that every feedback is taken positively, right? So the feedback should be balanced between the positive and the constructive feedback. The objective should be very clear that what you are expecting from the person. It should be observable. You should be giving feedback based on clear facts. It should be very precise and to the point. And when the person can review whether how much progress the person has made or not. It should be timely also, time to time giving feedback. So please remember how to give feedback on how to give a constructive feedback, how to give a coaching specific feedback, how to give feedback on behavior correction and positive reinforcement. For every pattern there is a type of feedback: boost, feed, grow, and coin. For performance review, you can use SEDAR, SEDAR, context, example, diagnosis, action, and review. Set the stage, be specific, give clear examples, share the reasons you have put a lot of effort into improving your skill. Do the diagnosis, that you are not giving just feedback superficially. Dwell deeper into the aspect, dwell deeper into the diagnosis of the entire situation. Plan steps. Okay, first you do this, then you do this, then you do this. Step by step action plan. And then put a timeline. We are going to review your progress on this date, on this day. So after 2 months, I will again check with you. Review timelines. So these are few of the ways to give feedbacks. For career development, you might have heard about 360-degree feedback, where the person gives feedback when there is a self-assessment, there is a manager feedback, there's a customer feedback, there's a peer feedback, direct reportee feedback, and there is a self-assessment. So that all clubs and gives a 360-degree feedback, that we have received a feedback from every person who is involved in the process, from customer to your manager to your subordinates to your direct reporting head, and you are also giving some marks to yourself as well. Now, coming to the last bit of our session today, what are the 5 things that every high performing team does? Number one, they are not afraid to pick up the phone. That means they are not afraid to just go and openly talk to each other. High performing teams communicate more often. They prefer phone calls. They prefer one-on-one meetings. They prefer clear communication. In fact, they can make 66% more phone calls than average teams. So high performing teams, they will just go talk to the person directly. They'll have an open communication. This is a research by Harvard Business Review. Next, they are more strategic with their meetings. They will just not simply sit and discuss on random stuff. They will have clear agenda of the every meeting. They will ensure that with every interaction, we are getting the best of our ideas. We are getting the best action points. We are in every meeting, we are finding pointers which can help us to improve our team better. So they will have every meeting very strategically. Number three, they invest time in bonding over non-work topics, over politics, over gossips. High performing team, They'll work and invest their time more on bonding, self development, interpersonal development. They also meet socially over tea, coffee. Team members often discuss personal interests. So whenever they get free time other than work, they will try to understand each other's personalities, where they are coming from, what was their previous work association like, to deeper the connection, and they will see that, and you will see that there is a sense of trust developing. Number four, they give and receive appreciation more frequently. They appreciate. The best teams are those which complement each other. You're looking very nice today, starting from that only. Okay, I like the way you work, I like the way you handle chaotic situation, I like how proper you are with your documentation skills, I like how you write good emails. It could be any appreciation. And fifth is, they are more authentic. They give feedback timely. They are not very, they understand the range of emotions for the entire team. Even if there is negative ones in the team, they don't try to suppress it, but they try to acknowledge it. They try to understand. They give opportunity to the person to listen, to speak, etc. Now, what are the key actions for building trust? Now, high performing teams, they have a strong trust in themselves, right? What can we do to bring that trust so that our team become high performing? Practice transparency. This we are summarizing our entire discussion for today. Demonstrate integrity. If you want to people to reflect integrity, first you have to demonstrate integrity as a team player, as a leader. Encourage accountability. Make people, take responsibility of their actions. Nurture inclusivity. You have to be more inclusive. Add perspective. Create a work culture in such a way that people embrace growth opportunities, which will help ultimately in building trust. Promote open communication. Commit to personal development. Every individual, in spite of us being in a team, people should not forget the fact that our personal development is also important. Cultivate reliability, that I can rely on my other team member. If I have having a difficult time understanding or doing a particular task, I can rely on my team. Collaborate, work together, practice empathy, how we are going to do that we just discussed, and empower each other. So this was how we can communicate better, collaborate, and establish strong connection with our team member. So I hope everybody liked the session. If there are any questions, please feel free to please feel free to drop your queries. I would be more than happy to address. So I could see there is one question on how we can manage the conflict within the team. Okay, so the conflict resolution techniques are also very important. I will just quickly share my screen to show that as well. Actually, that was the part of our today's session, but as we are running short of time, I did not cover that. Uh, Team conflicts, right? So there are four whenever there is a group cohesion. Uh, Four types of conflict you will see. The sole dissenter, when one person logs on with everyone, one person has issues with other people also, right? So that one person is responsible for the entire team conflict. Or there is a boxing match happening between two members of the team. Two members, they fight with each other, right? Number three, when subgroups are created within a group and people are having a conflict. And the fourth part, wherever there is a blame game happening. Okay, so now these are four different types of conflicts which can happen in a team. Now, as I said, apply the tools that we discussed. Uh, Keep a balance between your emotional quotient, your intelligence quotient, then you will be able to achieve your social quotient. So what is a social quotient? Is nothing but measuring ability to understand the social dynamics and build meaningful relations with your team members. So if conflict happens in the team, the only best way to acknowledge, to overcome these conflicting situations, is to have transparent and open communication, ensuring that conflicts are healthy, conflicts are okay. I don't mind conflicts. Conflicts should be there. That means the team is storming with each other's ideas and personalities. So conflicts should be there. Okay. If conflicts are not there, people are not having difference of opinion, that means that they are not even talking. But conflict should not impact patient care. Conflict should not impact each other's relation. It's okay to have arguments. So as a mediator, open communication, which where people can talk, speak their heart out, which ultimately leads to bringing strong collaborative environment to create trust within the team members, which is fine. So in the process of developing trust, conflicts might come, so don't try to avoid or delay conflicts. Even if there are conflicting situations, it's okay to have conflicts. Don't avoid conflicts or delay it. Try to establish open communication, and you will see that every type of conflict you will be able to address very effectively. Yes, so Dr. Russell, very well put. So I totally accept your suggestion. Thank you so much for putting it. Yes, it's very important on breaking a bad news and patient counseling. How patient counseling is to be done. I have seen hospital that they have forms for patient counseling. That doesn't replace the need of having a efficient communication with the patient. Just because you have a written document on counseling of the patient, there is a pattern of counseling. Patient needs to be counseled in a sequence. There also you have to check the emotional state of the person, of the patient relative, then design and frame your communication in such a way that whatever you're counseling they are understanding. How will you do a understanding check? How will you ensure that whatever you are saying the person is understanding in the exact way? How will you ensure that the patient to whom you are speaking is not missing out on the important details that you just have mentioned? So counseling skill is very important, and next session we can conduct for doctors on how counseling, how much counseling is important when it comes to patient education and information, and breaking the bad news. Of course, we are in a very sensitive work environment. How we should break the news in such a way that it should not just directly impact someone. How we can frame our communication in such a way that even if it is a bad news, it the impact is being measured, the consequences are being. I have some really dangerous examples, eh, which I have personally witnessed when I was working in hospital, that when the bad news was not communicated properly, what consequences the hospital and the staff members had to face. Okay. Okay, so there was a question on how does one exercise power if an employee does not follow orders? Okay, so the question itself has given the answer. You should not give orders to your employees. If you want them to develop as a healthy team, don't give them orders, don't give them instructions. And even if you feel that, okay, I will request them, that how will I exercise power as a manager? So please remember, you have the, as a leader, you have the responsibility to nurture people, not to order them. Okay. But even if, okay, even if you feel that whatever you say, there is a reluctance, people do not listen to you as a manager, you want to develop your own team, you want to nurture them, but people don't bother about your instruction or your order that you give, right? That time, that means your team is lacking trust. The team is not aware about the knowledge and the skill set of you as a manager. I'll give you a small example. I was working in one of the hospitals, and there was one of my subordinates. He was also leading a team. I was also leading a team. And we were noticing, he used to come to me, and when we used to discuss about our team, he said, Varun, my team does not listen to me. I don't know, whatever I say, they will just operate on their own way. When I dwell deeper, you will not believe, I got to know from his team that his team feel that he himself is not competent. How can he expect his team members to do a particular task? But he was very knowledgeable, but his team was not aware about his knowledge. I asked him, why don't you start taking sessions? Why don't you demonstrate before assigning a task? So, as a manager, if your team is not following through, number one thing that you can do is whenever you are giving a task to someone, first show them how that particular task is being done and then set expectations. Otherwise, they'll say, oh, this person, he will just give assignment to people. He himself don't know how to do that particular task and how much pressure it takes to complete that particular task. So if your delegation is not being taken appropriately by your team members, please demonstrate before delegating. People will start listening to you. Okay, another question. What pattern of activity do you think should be conducted in terms of communication, specifically for your OT team? Okay, it's a very important aspect. I'll tell you why. Because OT, they are like full time behind the curtain, be it any employee engagement activity, be it any training session, be it any festival celebration. OT team will always be in OT. They cannot just step out, eat a samosa with you, and then go back and do the surgery. No, once they are in OT, they have to be there till the entire surgical routine is completed, till the entire, surgical list, how many surgeries are going to be there. Okay, so OT is a department which usually gets ignored. Even if me as a manager want to do something for my team, the surgeries are so packed that they don't get time. So what activities you can do? Number one activity that you can do, please plan session for them on ergonomics. There are long hours of standing. OT team, I mean, I'm not ignoring the, effort of any other team, but please ensure that, if there are resting periods in between. For OT team, you can also plan OT appreciation day, wherever you feel that there are less surgeries, people who are coming in night for the surgeries. You have a senior leader coming up, appreciate the entire OT team. The appreciation is not just coming and saying good things about the OT. It also planning some management games, some case studies, which make them speak up, which make them give ideas, share suggestions to make OT a more, because I have seen OT people, they show good cohesion, but their mental well-being go for a toss. So, this OT days and planning the, day, wherever there is less number of surgeries, those days you can plan some management games, some problem solving activities, some, you can make small happiness videos with the OT team explaining about what they like the most about working in the OT department. As simple as that. So plan such activities which engage OT people beyond their regular work, and they can get some moments of happiness with the other team members. Also, many people, they don't even know who is working in OT. So in the reward and recognition time also, CSSD OT, who are always behind the curtain, should also be timely appreciated. Perfect. So with that, thank you. Thank you everybody for being so consistent. I could see the count was consistent throughout the session. I really appreciate everybody participating. I really appreciate everybody joining on time. Also, we would come up with similar soft skill sessions in future. You can reach out to us on info@medland.com. You can also follow us on LinkedIn. Stay tuned to LinkedIn because we keep posting about our training sessions, our upcoming, whatever trainings by the industry expert that we have planned. You will get all the details on our LinkedIn. So Subhashri has mentioned the LinkedIn link and our website link in detail in the chat box. You can check that, and we wish to see you in the next session soon. And Medland wishes you a happy learning experience. Thank you so much and have a wonderful evening ahead.